So within this broad group of patients either having bone marrow failure or a leukemia or myelodysplasia, over the years we have accrued many families from both the UK and abroad through our collaborative efforts with the various clinicians and families throughout the globe. So although these 100-odd genes explain many of the characterized cases, we have collected many families where the genetic basis still remains unknown. And so one of our high priority for the research group is really to characterize those uncharacterized cases. And probably in each group we have about 20 to 30% of families that are not characterized. And we're hopeful that with the newer techniques in genetics, such as next generation sequencing and genome sequencing, some of these we will be able to characterize over the next 2 to 5 years. So that's one thing, is to characterize the uncharacterized cases. But the second thing is that where we have them characterized, the current treatments, be it drugs like danazol or transplantation, they work in some, but not in everyone. So for example, you may not get a good donor in some patients because there isn't a compatible genetically normal donor in the family, or they come from a ethnically subgroup where there aren't many unrelated donors. So what you need in those patients is new treatments, and we're hopeful that if we define the biology and the primary defect, then in the course of the next, it's difficult to put a time frame on this, in the next 5 to 10 years, there may be new drugs that become available that are targeted against the particular primary defect you have in a given genetic subtype of these disorders. So that would be, I think those would be the two main goals for our group, as well as many other groups who are working on these disorders. So to characterize the uncharacterized cases and to think about finding targeted therapies for where present treatments don't work.